Silly me, says Alex Pearson. And here I thought it was just 150 million we wasted. No, it's 300 million thrown away to SNC to build non-existent field hospitals that now collect dust. Mobile hospital units sitting in warehouses, Omicron strains Canada's hospitals. But the buildings themselves, we don't have an issue with. The infrastructure themselves, we have an issue with staffing. It's not like we have floors of hospitals that are closed. We don't need a field hospital that could be put up in a parking lot. We needed staff. And they spent money on infrastructure, telling us we're spending no stone left unturned. We're spending all the money, every cent of money that needs to be spent is being spent. But they didn't tell us that we didn't have any nurses and that they were reducing the number of nurses who could be employed because they created vaccine mandates for the job. And unfortunately, it seems like the vaccine's a bit of a dud, right? Trevor says, Ottawa Hospital paying immigrant nurses $200 per hour, 3 times what a nurse with 25 experience gets paid, while hundreds of staff on leave because they chose to not take an experimental mRNA jab that doesn't preclude them from contracting or transmitting the virus. And somebody said, is this true? And he said, oh, it's true. Here's the article. Yeah. Here it is. In a message sent to all medical staff this week, the hospital's senior medical officer said the COVID-19 situation has brought us to a point where there is a significant strain on our ability to deliver the healthcare services at this hospital. COVID-19 situation, isn't it bad staffing policies that brought us to this point and not the COVID-19 situation? COVID-19 would have a bunch of people on respirators taking up everything, and you're short of staff because you're trying desperately to staff the COVID unit. Is that the case here? No, you fired staff who didn't take an experimental jab. I see how many of those staff are currently off right now. And you're short by how many staff? And you don't want them back because why? And you're going to pay inexperienced volunteers $200 an hour to do this? Crazy. In a mess. Okay, so it's not COVID. I just want to make sure everybody understands that what's brought the hospital to its knees is not COVID. It is the associated bad policy with isolation necessary for exposed individuals and the firing of healthy unvaccinated nurses. Okay, back to this. Hospitals and other institutions in Ontario are facing critical staff shortages and sharply rising demand amid record high COVID cases driven by the Omicron variant. The increased patient numbers and necessity of opening beds in unconventional spaces coupled with staff shortages due to illness has led to a critical lack of personnel to care for the patients. Dr. Kathleen Gartke, there's no L in there, wrote in the memo head, urgent action required. The hospital, she wrote, is reaching out to expanded group, including physicians and healthcare learners, for volunteers to assist with bedside patient care. Volunteers will be functioning in a non-physician role in areas in need of help, essentially doing the work of nurses. The work would be done under supervision, according to the memo, and those who volunteer to do the work would be paid $170 or $220 an hour. Sorry, I'll say that one more time. Those who volunteer to do the work would be paid $170 or $220 an hour. The higher amount applies when work is done on weekends, holidays, or after hours. This is the same amount Ontario physicians who volunteered to work in vaccination clinics have been paid during the pandemic. It's also about 3 times as much as a nurse with 25 years experience earned for the same work, noted Rachel Muir, a nurse at the Ottawa Hospital. So not only did they fire nurses, they are now giving untrained volunteers a raise, like a massive raise. Please come in and work. And if you, unvaccinated nurse, come back, you can come back. You come back at your old salary and you have to pay for testing. Do these people have to be tested? Do these people have to be vaccinated? I'd go the volunteer route. I'd be like, yeah, I'll volunteer. Sure. I'll come in and volunteer. That's what I'm doing. Volunteering for that $200 an hour job. Money, please. Volunteer all day for that. Right. Unbelievable. It makes me so angry. Right? I think that it is a situation that we are not holding anybody accountable. Nobody is accountable. The liars in the newspaper, the editors who allow this garbage to be printed, the idea that laying off nurses and paying untrained volunteers 3 times what a nurse who's 25 years in the business would make is a good idea, or even a solution, a viable, workable solution. Like, if you're sitting around that table, you're like, okay, we don't have any nurses. What do we do? Let's bring in untrained volunteers who were supervised by a nurse. I'm liking it. Let's pay them 3 times what we pay a veteran nurse. Love it. Do it. There's no other ideas around this table. Nobody has a clue what to do. So they come up with the stupidest idea in the world. This is not sustainable. How much money do you have? Money is no object? Give me strength. I have no idea how we get out of this, because it doesn't seem like any rational person is looking at this and saying, this isn't sustainable. We can't do this forever. How is this a pathway out of this? We were told vaccines is a pathway out. Clearly not true. So now we need to take that information back to our leaders and say, you lied to us. Explain yourselves quick. That's where I'm at. And what I want is accountability. That's all I want. Thanks for watching, everybody. Check out CanadaPoli.com. Check out CanadaReport.co. Check out SpeakingMoistly.co. And have a wonderful, wonderful day.